Hey guys, we're discussing chapter 16, segment 3, and we're going to begin by discussing avoidant personality disorder. Avoidant personality disorder is characterized by social anxiety and feelings of inadequacy. And those who suffer from a social phobia, they tend to be overly sensitive about negative comments or behaviors from other people, and therefore avoid interpersonal contact so they can avoid any type of contact with other people, and they don't develop friendships or they can't hold a job. We're not really sure if we can detect psychopaths in the modern world. There's something called antisocial personality disorder, and those people with that disorder are characterized by a pattern of disregard for other people's rights with little evidence for remorse or harm for those others. There's a psychopath checklist. It's also sometimes interchangeable with the word sociopath. Some examples are that they're pathologically liars, they're always lying, lack of remorse or guilt, failure to take responsibility for their actions, etc. ASPD is very difficult to treat because sometimes these people can seem normal and it's sometimes hard for them to seek treatment. This is a myth about what dissociative identity disorder is, which is a mental disorder diagnosed in a person who supposedly has at least two distinctive enduring personalities that takes turns controlling the person's behavior. Now we're going to go into what schizophrenia and bipolar disorder is. First, we're going to define what delusions are, and those are false beliefs strongly held in spite of contrary evidence. It's basically when people see things that are not happening. Dissociative thinking is a major impairment in the logical structure of thought, which is a symptom. And schizophrenia is a disabled mental disorder characterized by hallucinations, delusions, disordered thinking, and emotional withdrawal. The symptoms that are indications of schizophrenia include auditory hallucinations, highly personalized delusions or false beliefs, disorganized speech or behavior, and cognitive impairments. There are two separate groups of major divisions of schizophrenia, which are positive and negative. Positive symptoms refers to behavioral states that have been gained. These are hallucinations, delusions, and excited activity. The negative symptoms refer to the behavioral functions that have been lost. For example, slow and impoverished thought and speech, emotional withdrawal, etc. Anatomical differences are seen in the brains of many people with schizophrenia, and this discusses how different studies have been done to refer back to how the brain is different. There's a strong genetic component to schizophrenia. A lot of twin studies have been done with it, and schizophrenia is an inherited susceptibility to stress, especially earlier in life. And the last thing we're going to talk about is how antipsychotic medications revolutionized the treatment of schizophrenia. One of the desperate ways that psychiatrists turn to was lobotomies, which are surgical separations of a portion of the frontal lobe from the rest of the brain as a treatment for schizophrenia. But there's not a lot of scientific evidence that the surgery was effective, but sometimes it would miraculously work, and it was used back in the day.